Hello friends, my name is Rohit Singhaniya, doctor and content creator. So today we are going to discuss about how to analyze GT. If you want to know the importance of GT, then I have created a video already on why to give a grand test. Link in the description below. Coming to the analysis of GT, I would recommend that you review the GT on the same day. Suppose in the morning you gave your grand test. After that, have lunch, take afternoon nap if you want to get recharged, and then get on with your review. Because on the same day, thought process behind each question is fresh and you know where all you made mistakes. So it becomes easier. There are two methods of reviewing a test. First is subject wise, in which you choose subjects and then you analyze each subject separately. Second, and my personal favorite, is to go in one stretch from first to 200th question, because reviewing in the same sequence helps me better to recall my thought process behind that question and to analyze whether my thought process was right or wrong. Maybe because I'm walking to the same road again, so it's easier to recall what happened in that journey. Now during the analysis, there can be two things. First is you know the topic. If you know the topic, then it can lead to these things. First is you know the topic and you marked it correct. Then you don't have to waste time on that question. You know the topic, you have marked it correct, that means you know it. So don't read the explanation, go to the next question. Maybe the next question which you marked is incorrect, but you thought you knew the topic. So it can have few possibilities why you have marked it incorrect. First, it can be a fact-based question or it can be a conceptual question. If it's a fact-based question, then you have to remember that fact itself. So what you can do is make mnemonic, story, put vulgarity, something or the other, and post it on the wall, write it in a separate notebook so that you can recall, revise it again and again. If it's a conceptual question, then again the same thing. You have to clear your concept and make some story out of it so that you can remember. Another reason for marking it wrong, even though you thought you knew the topic, can be getting confused with another question. It so can happen, for example, treatment of osteomyelitis, acute osteomyelitis has been asked, and options can be amputation, surgery, incision and drainage, antibiotics. Now I got confused. When I was giving GTs, I got confused between osteomyelitis, acute osteomyelitis and septic arthritis. So I kept thinking that answer is incision and drainage. When I realized that acute myelitis treatment is antibiotics and septic arthritis treatment is incision and drainage, I realized that both topics are so different and how can I differentiate them and how differently they are treated. The same way, if you are getting confused between two topics, then try to find a way to differentiate those two. Another reason for incorrect answer for a known topic can be words such as all except, not, incorrect, etc. Another possibility can be that you don't know the topic, but still somehow you mark the answer correct. First, it can be a random guess. In that case, you should go to the topic and get thorough with it so that you have a better picture and clarity in that area. Another way of marking it correct can be that you were familiar with the relevant topics, and based on that knowledge, you were able to rule out other options and reach to the right answer. In that case, you should again go to the topic, get thorough with it, and try to relate with all the relevant topics so that you don't get confused with it afterwards. Another thing can be that the topic was unknown, so you marked it incorrect or you didn't attempt the question. For these two questions, after giving the test, try to think and analyze how you could have reached that answer. During analysis, try to think how you could have reached that answer based on the knowledge in different sectors which you already have. This will help you to relate all the subjects, and also it changes your mindset to get to the answer even though you don't know the topic properly. Also, for all the don't know topics, you should go through all of them and get thorough with it. During the whole analysis, try to jot down important topics and points of those topics, try to make mnemonics and stories out of it. And before the next GT, try to ace these topics and read them again and again. Now few people ask what to read till next GT. So there are three options. First is you have a schedule of all the 19 subjects, and in between them you are giving GTs and analyzing them. Second is whenever you give a GT, after that lowermost 3 to 5 subjects you choose and read them for the next week and then appear for the next GT. The third is hybrid, which I personally used to follow. According to that, suppose I gave GT today, and till the next GT, I was supposed to read psychiatry, pharmac, radio. But my psychiatry was on the first place, and other 3 subjects which were below were radio, pharmac, derma. For the next week, coming week, derma was assigned. So what I'll do is, I'll change this derma from here and psychiatry from here, and I'll switch the places. So with that, I have a schedule and I'm going to move with my schedule, but I'll make small changes based on my lower 4-5 subjects. Like that, for the next week also, I will make small changes based on which subject is above and which subject is below. Also, I'll keep checking in my checklist which subjects are done, so that with this little bit of randomness, I'm not missing out on any subject. That's all from my side on GT analysis. Hit the like button, subscribe to my channel, put a feedback for this video and suggestion for the next video. Until next time, take care and keep going. You got this.